Dr. Raman. He is a Principal Fellow in Health Governance Hub in the Public Health Foundation of India. He has served earlier in the State Health Resource Center, Chhattisgarh, in different capacities as Program Coordinator, Chief Coordinator, and Director in charge. His work has largely been built around the sectors of public health and education. Dr. Raman.
Thank you, Rama. Here, yesterday onwards, we were talking about how to implement UHC, and there were several critical questions raised by the bureaucrats, particularly Ms. Girija from Tamil Nadu was raising some critical questions about how to understand UHC, how to implement UHC, and how to go forward in terms of UHC. So we are presenting a group of authors prepared, trying to prepare something to answer these specific kind of problems that are faced by implementers. Namrata, Prasanna, Kabir, and Nikhil are my colleagues in this, paper. Most of them are around. So here, if we see the context of health governance, state of health governance in India, we are having the program-driven policy paradigm. That is one of the major issues, wherein institutional structures for program implementation is a neglected area. And Professor Mill's presentation yesterday was talking about a lot of institutional processes. And populism-driven program designs leading to piecemeal approaches is another kind of problem that we are facing. And a lot of committees, from Bhore committee onwards to the HLEG, we have a lot of reports in safely kept in shelf. And if you ask the implementers, what is the issue, most of the time the answers are the questions that were coming in yesterday. So the HLEG recommendations, if that needs to be saved from keeping in abeyance, we have to have some preliminary steps, some preparatory measures to be completed. And the governance toolkit, we are thinking that could be a kind of intermediary approach before we start off the implementation of USC. What all systems, what all processes, what all institutions needs to be installed or initiated or dismantled, or all those issues will be coming in. So the toolkits, as of now, the tools are like this. The tools itself are, they are weak, so they are not able to fulfill the function of the tools. So the rationale of the toolkit, the toolkit that we are proposing is the overly top-down and prescriptive nature of the guidelines, or lack of details in the guidelines need to be addressed. So the guidelines are to be well prepared. And then flexibility for implementers is a major issue. When we make a national level guideline, we need to understand there is northeast, there is south, there is mid, and all the empowered action group, whatsoever we call. So all these state level implementers and district level implementers and block level implementers will be having their own issues. And then some of the institutions are already there. Again, I'm going back to Ms. Girija's questions yesterday. Whether the UHC could be a taking forward of NRHM was a concern. So unless and until we look at the existing institutions, unless and until we think about them, change them, reform them, they can create a lot of further problems. So these three are the major kind of rationale that we give. If you look at before you run the train, you have to have the rails in place. So that is the major thing. So you have HLEG recommendations. So before you get into the last actualization of USC, you have to have some thinking of what are your toolkits for implementation, and then you have to have the systems and enabling structures in place for kind of actualizing the UHC. Will be the stakeholders, and in the stakeholder listing we need to necessarily list citizens as stakeholders, not only the implementers and providers. And what are the financial implications for such a thing, and each action point needs to be detailed in this way, and then this needs to be verified by those people who does actual job at the field. So this is the kind of process that are involved in this. So you can see what is a sample toolkit. It is for the TOR 4 of the HLEG report, which is on the community participation and citizen engagement. And the recommendation specific addressed is about the formal grievance redressal mechanism, wherein we have identified the first action area as preparing a broader framework for constituting public grievance redressal system for UHC. Then notification and formation of a national working group as first step. Before you implement this, then preparation and approval for the broader framework for grievance redressal, then approval of for model operation guidelines for the states, then preparation and notification of model TORs and criteria for grievance redressal bodies, then budget preparation, finance allocation, HR allocation, those critical aspects of doing, then national level notification on the public grievance redress. This is for the national government level. Then we have to have a toolkit at the state level. Similar processes may be needed. Then we have to have a toolkit for the district level and block level. All these decision making levels have to have some steps to follow before we go forward with the USC. And the way forward, we have, so far it's a kind of toolkits are there, several kind of toolkit approaches are there across the country and the globe. But this particular toolkit, we are, it is not really in the same way of all the other toolkits are doing. You can see the format and, it is going by action point, sub-activity, listing of stakeholder, timeline and financial implications. This is the way we are trying to make it. So we have so far listed action areas for all the 64 recommendations of the HLEG. Then sub-activities identified for so far 4 chapters. That's why in the initial slide I put work in progress. Then the toolkit has been finalized for 1 chapter, the community participation 1. And draft toolkit for all the other HLEG recommendations would be ready by end of 2012 as we expect now. And then it will be verified by experts. Then we are also trying to do some threshold support to some of the states, whoever is ready to experiment this kind of a doing. And we will also go towards, as of now we are limited to the state and national level, we are also planning to go for the district and block level wherever such a support is available. Then lessons from these processes are: 1, several newer institutions are implicated. Then massive HRH and human resources, health and capacity building needs are indicated while making this toolkit. And I can put up the numbers also, but as of now I'm not doing it within the 10 minutes. I can only put up an abstract of the abstract. Then it needs huge insourcing of expertise. It's not about outsourcing, because if we have to do USC, we have to have internal capacity. The block systems, district system and state system, all of them have to have their internal capacities. And then we need to ensure inter-institutional and intra-institutional convergence for doing this. Then local and community level processes are coming as central to all the recommendations. Unless and until we have some thoughts about how to engage citizens in all these processes, it is going to be difficult. And each and every recommendation has to have the equity lens as well. Otherwise, the inclusion cannot be ensured while implementing them. Then interconnected and interdependent nature of all the recommendations. Sometimes, you will repeat the same kind of tool for several recommendations. That is another issue that we observed. Then newer systems can layer into existing decision-making structures. So we need to think about how to refurbish or dismantle or change or whatsoever them. So with that, each USC recommendation calls for setting up and refurbishing or dismantling of several structures and systems. Then we cannot see any of the USC recommendation in isolation. Now the Planning Commission and the Government of India is talking about district level pilots of USC. Before you enter into the district, we have to address lot many things, because the policy, health policies are looked at. Health is a state subject. We have to look at lot of changes at the state level before we start even the district level implementation. Then if you look at the timeline, the national level toolkit, the kind of preparatory measures may take some 24 months as per our toolkit, and at the state level it can go up to from 48 months to 60 months. Meaning it is not an express way we are seeing. We are seeing that it's going to take some kind of to prepare for having a full-fledged USC itself at the state level, we are going to take some time. That does not mean we have to stop. We have to do both in parallel. So we have to create the way and travel together. Thank you so much.
Thank you very much.